So we're going to consider using the Autopulse for patients that we anticipate will require a lot of CPR. It's kind of cumbersome. It's a lot of work to get it going just for that kind of short code that we might be doing. What we're trying to do is also consider exposure of healthcare providers for the patient or the situation we might be dealing with, and the fact that we know that CPR quality goes down the more you do it, the more tired you get. So this is one way to mitigate that. For adult patients only, so you're going to either know it's an adult or heart and stroke guidelines, those patients who have developed puberty, so you're looking at breast development, pubic hair, facial hair, things like that. That would also be considered appropriate for this, but adult patients only. There are some contraindications about chest size, so minimum 30 inches of chest circumference. If the patient's chest is too small, then it's going to have too much slack on the band to be able to compress. 50 inches on the large end, the patient's chest is just too big and the band's not long enough to do that compression. Arthur, you're likely going to be the physician, but I'm going to get you to do chest compressions on this patient. So there's an RT managing the airway, there's a physician managing the code, typically a nurse or maybe paramedic doing the chest compressions. We've identified that, hey, let's get the Autopulse. So Rachel, you're going to bring the cart over to the location. It's not plugged in or anything, you just need to bring it over. Compressions.
If you look carefully at the green numbers, it will tell me when I'm in target as far as rate and depth of compression. And I'm having trouble seeing it because it's upside down right now.
So you need to go a little bit faster. You're only at 90 beats per minute. There you go. That's better. Good compressions. A little bit deeper. Let me get that to... Your depth of compression actually is good, but it's not turning green. There we go. Okay.
You just try to find that rhythm, so both numbers are green.
We're doing ongoing chest compressions, and so we're going to get this set up. So you're going to lift this up, and it's going to kind of fall forward. So you're going to pick it up. It's kind of heavy. So now we've got Adrian here. So Adrian, you're going to take over for chest compressions from Arthur. We're going to do it in a controlled fashion. Arthur's going to keep doing chest compressions until you count down and Adrian is ready to go. Maybe at this time we're also going to do a
26,
pulse
27, 28, 29, 30.
Okay. So RT gives 2 breaths. Adrian right into chest compressions, and I can see that a little bit faster. Good.
Perfect, right on target.
Okay. So now we're going to set this up at the head of the bed.
Okay.
So we're going to just stand it up there. The head goes up here. Just set it on the mattress there. Just stand it up. We're going to, you need another person to undo this. And then in a controlled fashion, Dr. Shoup is here, so you're going to help us move the patient. So you're going to be on that side. In a controlled fashion, we're going to lift the patient up. We're going to slide the board under him. This yellow line here goes at the axilla line. So that's what you're going to landmark for there. So Adrian, in 3 seconds, you're going to stop. We're going to lift the patient up.
1, 2, 3.
And we're going to slide that underneath. And a little bit more. And put him down. And so you want that to be, now the mannequin has to be a little bit higher than a real person. Just because you're going to go underneath the arms.
Go over the path, over this stuff?
Yep.
Oh yeah, that makes sense.
Place that down, place that down. And because we're doing other things, we didn't turn it on, so press the power button first. On, off, at the top. Yep. Then if this isn't fully extended, you're just going to lift it up and place it on the chest. That's going to size it. The start button is going to size it. Then after 3 seconds, it's automatically going to start compressing. So the other thing you want to notice on the defibrillator, it says Autopulse. So it's not giving you that depth and rate of compressions. It's automatically detected that we're using an Autopulse.
Yes, just that.
Automatically set that. So now our hands are free. We're able to intubate the patient. We're able to give medications. So after 30 compressions, we're going to prompt you to give 2 breaths. We're going to pause for the 2 breaths.
And I recall you kind of change it to continuous.
So now my RT is still managing the airway. My physician is still managing the whole process. The nurse is now able to give medication. Say we're at the point where we're going to intubate the patient. After 30 compressions, you're going to give 2 breaths. But let's say Dr. Sheep is ready to intubate.
Okay.
So she says pause compression. So you've got all the stuff set up here. So you're going to stop the compressions there. Now you're ready to do your intubation. The medications we're given, let's speed
Yeah.
things along. Now we've got an advanced air. We've got an endotracheal tube.
Yep.
We're going to restart the compressions. And now we don't want to go 30 to 2. We want to go continuous compressions with 1 breath every 6 seconds.
Yes.
So the gray button there, switch to continuous and then confirm. Now you've got continuous compressions. And if you listen every 6 seconds, there's a beat. So the RT is going to give a breath. Every 6 seconds.
Wow, it tells your breath rate.
And this is crucial because one of the common complications in all of the excitement of resuscitation is overventilation.
Yeah, that's perfect.
So another situation, maybe we want to pause compressions because we want to do an ultrasound.
Yeah.
So Adrian, you can manage this. We're going to stop compressions. And you come in, you do a point of care ultrasound. You got your lube and you're getting your probe in and you're having trouble seeing things. And after 10 seconds, it's going to beep once. And you're like, okay, give me some more time. I'm still looking. I'm not sure there's contractility or not. There's some, is that really output or not output?
Yep.
After 20 seconds, it's going to beep twice. So that's another audible thing that says, okay, let's get back to chest compressions if that's what we need to do. After 30 seconds, it's going to be continuous. So now you have to have a choice. Okay, let's start compressions, or I can silence that beeping. And it's going to then give me 30 seconds. It's going to start beeping continuously again.
Okay.
So let's restart our compressions. And press it again. If you press it twice on, like 2 consecutive times, it starts automatically. If you press it once, there's a 3-second delay, and then it'll start.
You know what it resides? Like,
If it's been moved, or if it senses it's been moved, it will resize.
how long have you been getting the compressions?
Yes, so it's going to count up to 2 minutes, and so you can see how long that's been going on. The current battery is full. It gives you, the manufacturer says 30 minutes of continuous CPR time. If there's pauses, if there's other things that might be a little bit longer. But bank on 30 minutes. We have 2 other batteries there that we can swap out. So theoretically an hour and a half of Autopulse CPR availability. So let's say